was one of the key PPP models that helped in getting Nigeria to be declared polio-free after about 10 or 15 years. So it's a pooled arrangement where the government must contribute, the donors must contribute, and the private sector contributes, all of it to finance primary healthcare delivery, which I give an example of polio. Or you can choose any priority. You can choose the priority area or program area, or whatever you choose. This basket funds model will allow funding flow into those programs effectively. I think part of the proven ones are in Nigeria with Zamfara and Kano State, where the basket funds helped ensure the availability of funds to implement primary healthcare plans and also enhance accountability, while also still creating transparency, which is key, transparency in how, when, and where funds are dispersed. So that's very key. Another example would be for hospitals. This is not in Nigeria, but there were hospitals, they call it public financing initiative, where the PPP provider, you get the private to construct the hospital, set up equipments and all other non-clinical services, while the government will provide clinical services. Then you have some kind of arrangements there. The only thing that is worth mentioning is you have to be careful in evaluating the PPP. Still in Africa, we have the PPP that's got stuck halfway. The Lesotho Public-Private Partnership is quite an ambitious one, where government, new healthcare facilities and broad range of clinical services are contracted out to the private. So at the contract's halfway point, it became too expensive. Though the quality of service was relatively high, but the government was not able to maintain its own part of the, or is struggling to maintain its own part of the contract. So we need to make sure we balance how we get into PPP. Don't get too excited or carried away. Make sure you tailor it to the peculiarities of the particular country and what the government can do in terms of managing complex contracts as well.
Okay. Well, in line with the recent outbreaks we've had, we have the current Mpox virus, we have the Marburg virus, and of course we have the COVID-19 pandemic and other outbreaks. And now these, health scares and crises, they have reshaped the way businesses are looking at health and safety within their operations. Well, how would this, in line with all of these outbreaks, how would this help strengthen global supply to get these vaccines and of course everything that they need down to vulnerable populations?
Yeah, so I think generally all of this is lessons learned, right? All of the lessons we're learning from this pandemic, especially the most prominent one, like I keep mentioning, is for the COVID-19, right? So it has strengthened our hygiene protocols. It has also shaped our culture of work. I think even if there was remote work before, it was the COVID-19 pandemic that made it more prominent, even organizations that we never thought would do remote work. Then there's crisis preparedness, right? People are more prepared for crisis now. There is robust crisis management strategies out there that many organizations have rolled out. Then it has let us embrace technology even more again, technology adoption, because we saw the impact of technology towards mitigating COVID-19 and also towards helping us getting back quickly to our day-to-day lives. So one of the most important things you talked about now, which is the supply chain, is actually the key learning points for COVID-19. Most people that had single-sourced supply strategy or plans, they were devastatingly impacted by the COVID-19. So one of the big lessons learned is for you to build resilient supply chain systems, robust and resilient supply chain systems, so that if one area gets affected, you could still get delivery through alternative means. So that's what companies have learned, and not only companies in health, even globally, countries like United States have learned not to over-depend on certain supply chains tied to one particular country or other because of these lessons that they learned from that. So all of these are very key things that we've learned, and we know that they will help us even in terms of reaching the underserved in the next pandemic, because there's investment now in local production, there's collaboration with NGOs and government that know where the underserved areas or populace are, so that we can tap into that knowledge. There's technology and data sharing, which is key, because the data that you share will give you insights and analytics for you to make quick decisions. And then there's enhancement of distribution networks. People have seen that they can even make money from investing in logistics and transportation businesses or infrastructure as well. And people are also looking at sustainable sourcing, so that just like supply chain, you're building a resilient supply chain, you should also make sure your sourcing is also very sustainable. And then lastly, because I know because of time, there is emergency stockpiles, right? So stockpiles, critical things are stockpiled so that we can respond quickly to reach underserved areas if another emergency or outbreak does happen. Yeah.
Okay. Mr. Abdulhamid, it's very interesting that you've mentioned all of this because now I have to ask, in your opinion, what are some of the most significant barriers to achieving comprehensive health solutions in Africa? And also, I have to ask, how can businesses like eHealth Africa build sustainable models for healthcare that can not only respond to emergencies but also improve long-term health outcomes? And that this is across the continent.
Yeah, so two questions or two discussions in one. I'll be quick. I'm sure we are running out of time.
Yeah.
First one will be the barriers, right? Of course, financial constraint. Money is always useful. Revenue, funding is always very key. So there's limited funding and resources, and this hinders the establishment and maintenance of health programs and services. Then you have infrastructural deficiencies. We've talked about it, right? So sometimes you want to deploy, for COVID-19, we saw it, which I'll talk about maybe next, but the infrastructure wasn't even ready for some of the things or technology or the solutions that we wanted to deploy. So in such a case, you have an issue with infrastructure because of the deficiency. You have to make sure maybe that's more of government or partnering with private, but you have to strengthen infrastructure so that they are even ready for some of these solutions that we talked about that will help us curtail these outbreaks. Then there's workforce shortage. Of course, it's a no-brainer. There is a shortage of skilled workforce or trained healthcare professionals, especially now with the JAPA syndrome as well. Then there is a shortage of local innovation and technology. More often than not, we have to import this technology. They might not necessarily address the peculiarities of the particular community, right? So, but as opposed to if you build the technology, you will have the requirements of your local community in mind before you even build the technology. So you won't have that potential mismatch. Supply chain challenge, we talked about it, is still an issue. Then cultural and educational barrier as well. In some areas, the culture inhibits the quick adoption of these healthcare solutions, or even during the intervention program, you might have get stuck with due to cultural or educational barriers. Then there's political instability as well, conflicts, unstable governments. That always impacts on anything. So that's a no-brainer. And some of the solutions you can take towards this would be for you to build strong, robust public-private partnerships. Make sure you get governments either with private funding to invest in infrastructure, and make sure there are also innovative financing solutions, which we talked about some PPP models just a few moments ago. So make sure you tap on those things. Now coming to the last part, which is how we are building. First of all, we call it sustainable public-private partnership. It's not just enough for you to have a PPP, but we want it to be as sustainable as long as possible. So we lean on this type of partnership structures to ensure long-term stability. So our Decade on Polio will be a good example. We partnered eHealth ourselves, eHealth Africa. We partnered with BMGF, the Bill and Melinda Gates Foundation, state governments, local governments, and other key stakeholders. And all of these efforts were instrumental in having Nigeria declared polio-free. We also have what we call the proactive innovative approach, where we come up with, in contrast to the traditional norm of waiting to respond to pandemics, we are now creating models. That's why I said AI was key. Models that we can use to predict these outbreaks so that we can take the necessary measure before it happens, or even if it has to happen, then we can mitigate quickly. Then impactful CSRs, corporate social responsibility, right? Very key. It's a weapon that you can use. If you are very intentional about it, you can use it to drive impactful healthcare initiatives. We have done a lot in that. We have our data portal, which aggregates data over a decade, geospatial data. We democratized its access free of charge to anyone. Any health person in the healthcare sector can use the data for planning purposes, campaign planning, and other medical outreach planning as well. We also have the EHA Academy. It's our way of giving back to the society, where we offer free career training for software development. This helps us have a pool in-house of people that we can tap into for technical roles. But the academy is open for everyone. A lot of people are from the outside, they participate, but it helps us keep a pool of that talented health technologists for our own recruitment, and even other organizations' recruitment as well. And then we have the CDI, Community Development Initiative, that we do, blood donation drives, tree planting, free medical screenings, free medical glasses. All of those things are under our CDI that we do as well. Then lastly, use of technology. This is one of the most important factor. We never miss out on any opportunity to develop technology that can drive or accelerate health programs. We have our LOMIS, Logistics Management Information Suite for healthcare supply chain. We have a BISCIT for blood crisis management. We have PlanFeld for health campaign planning and monitoring. We have the